Now that a global pandemic has been declared for COVID-19, you have been sending us more questions than ever. So we want to get through as many of them as we can for you tonight. Joining me now, we have Dr. Susie Hoda, Dr. Samir Sinha, and across from me, Dr. Allison McGeer. Dr. Hoda, I want to maybe start with a broad question. The significance of the declaration today, that this is in fact a global pandemic. What should we make of that?
Yeah, I think it's a great question. I think it brings us to speaking common language. But fundamentally, it doesn't really change anything that we're doing. We've been preparing for this kind of event for quite a while now, and really just making our decisions based upon what's happening across the world and in our local regions.
Yet this comes on the same day, Dr. McGeer, and just a few moments ago, where the President of the United States, Donald Trump, just declared that there would be a travel ban of people coming from Europe to the United States. And the UK, I understand, is an exception. Is that the right way to go at this point?
So I think what the science tells you is that travel bans are not nearly as effective as you think they might be. And I think we, for instance, in Canada, should be really pleased and proud of our government for holding on to the science-based approach to what works and what doesn't work. And I think for all of us countries at the moment, I think we really need to be focused on what we need to do to protect ourselves from community transmission in our countries, as opposed to worrying about what happens with other people coming from other countries to us.
Well, let me push the question a little bit further. I mean, you talk about spread within our countries. Let's talk about Canada and the United States. Do you ever foresee a day where the Canada-US border could be closed down? Because in a way, we're sort of like one country. You can feel that way sometimes.
Yeah. I think we're probably not going to do that, in part because we recognize that travel restrictions are one piece of public health interventions that might slow progress down. So there's a bit of a temptation to say now that because we have so many fewer cases in Canada than some places in the United States, that we might worry about travelers from the United States. But again, that kind of restriction might delay our outbreak by a week, maybe even 10 days.
Right.
And the damage that it does is probably just not worth that week's delay, and it's only a week's delay.
Dr. Sinha, at this stage in the game, with what we know, how much more dangerous is this coronavirus compared to something like, say, the seasonal flu?
Yeah, well, I mean, when we compare things like SARS versus coronavirus versus the flu, we know that SARS, for example, killed 50% of older people who would get this. Right now, we're seeing that rates of about 15% in the elderly with COVID. So less deadly than say, SARS, but it's 7 times more deadly right now than the flu. So it's something we need to be worried about. But again, many Canadians right now haven't even gotten their flu shot.
Right.
And so we should do things we can protect ourselves against right now.
But and I remember you mentioned just a few moments ago the importance of getting the flu shot. You also mentioned the pneumonia vaccine. Is there any sense that either of those two things help protect particularly against this coronavirus?
Not particularly against the coronavirus. Right now, there's work going on for a vaccine against that.
Right.
But what we do know is that if you get COVID, for example, you might also get a co-infection with a bacterial pneumonia or potentially influenza. So the thing is, by maximizing your protection against other things that we know we have tools against, that's how you can best protect yourself overall.
If you do get COVID-19, how do you tell the difference between that and something like, say, the common cold or even the flu?
There's a lot of overlap in the symptoms, especially since 80% of people with COVID-19 have fairly mild symptoms that, can have runny nose, sore throat, cough, fever. So really, it comes down to the testing.
That's the only way. There's no way to tell just from the symptoms that you have.
Just from the symptoms, it's very difficult to distinguish between the two.
Do we know if you get sick from COVID-19, whether you can get sick again from it once you've recovered, or do you develop a kind of immunity from it? What do we know on that front, Dr. McGeer?
We do know that you make antibodies pretty quickly when you get infected, and they look like what they're called neutralizing antibodies. So they look like antibodies that should protect you from reinfection. But the truth is, until we can actually test it, until we have a group of people who've had it once and been observed to be exposed,
Right.
We're not going to know for sure. So that's some months away, probably.
And along the lines of this question, and Dr. Hoda, maybe I'll put this one to you. One of the questions we actually got recently was if wider community spread is inevitable, this person's asking, should I try to catch COVID-19 now in order to not overwhelm the system? later on down the road.
Yeah, that kind of a strategy is not something we're encouraging at all. I think what we're still trying to do is prevent people from getting it as much as possible, especially those who could be vulnerable to get really the more severe illness, the elderly, those with other health conditions that put them at risk, like heart disease, lung disease, diabetes, cancer, and immune suppression.
Dr. Sinha, how are you advising your patients in terms of how long the virus can survive on surfaces? And so think of desks, or think of phones that people have, or think of their clothes, you know.
Yeah, right now what we know is that it can last for hours or even sometimes days. And so if you're touching surfaces that other people may have touched, for example, it's a good opportunity to clean them and make sure that you wash your hands. And those are some of the things we're recommending right now. But we're talking about maybe hours to days. And so that's why it's just best to, make sure that surfaces that other people might touch, you're keeping clean.
Is there a point in the very near future, Dr. Hoda, that you think that folks should really be thinking about avoiding high traffic areas? So, shopping malls, movie theaters, public transit, that sort of thing.
Yes. I mean, those are what we call sort of social distancing, or, just trying to keep people from congregating in areas where you can have a lot of traffic, a lot of, a lot of people together. And at that point, that point will be decided by public health and communicated to the public.
But you don't think we're necessarily at that point where we should all be reconsidering our plans?
No, not at this point. I mean, right now, at least in most parts of Canada, we haven't seen community spread. So, it's not until we see that it's more widespread that we would actually want to try and prevent people from being in close contact with each other.
When it comes to a lot of folks being together in the same place, Dr. McGeer, one of the recent questions we had was around cruise ships, and we know that these can be fairly sort of infectious places, for lack of a better word. But they were wondering if that's true for cruise ships, isn't it also true for the apartment building that I live in, the condo, the big sky? Thousands of people live there. We're all using the same elevator.
No, so completely different. If you think about a cruise ship, first of all, the space that you're living in is much smaller, right? You have a stateroom, okay, which has a bed in it and maybe a desk, and then the entire day you are out with other people. You're eating with other people. You're swimming with other people. You're, I don't know, playing pool with other people. So cruise ships are in fact very, very crowded environments. You have a lot of close contact with a lot of people, and a piece of this is just empiric evidence. We know that cruise ships are a huge problem for influenza outbreaks and gastroenteritis outbreaks, and that's the living example. That doesn't happen in your apartment building. So your apartment building is different.
I have time for one more question, and Dr. McGeer, I'll put this one to you as well. If once the weather starts to warm up, does that mean the virus will wane in any way?
I think the answer is we can hope. Many respiratory viruses do not transmit as well in temperate climates in the summer months. We actually don't know why, which makes it really hard to predict what might happen. And so I think there is reason to hope that we might get an abbreviated wave and then a break until the fall. But it's really just hope. It's not based on evidence, and it may just be that this virus will keep going right through the summer.
And just speaking of hope, I can't help but think of the possibility of a cure, a vaccine. I suppose that's still a ways away as well.
People have taken the example of Ebola, where a huge amount of effort went into accelerating a vaccine, and the world did an amazing job about getting a vaccine out, and it works, okay? It's awesome. And so I think there are a lot of people that are hoping we can replicate that, but replicating that still probably means a vaccine is, at a minimum, 18 months away.
Dr. McGeer, Dr. Sinha, and Dr. Hoda, thanks so much for this.